Thank you again, Mr. President. For all practical purposes, I think you'd have to say that our legislative efforts were very successful in this last session. It's always a challenge. I think there were 60 new House members and a new governor. And so it always occurs when there's a new governor that always kind of slows things down as well. I've always thought there was a form of a system where you shouldn't have new legislative members and a new governor sworn in there immediately in the first session. And so we were held up trying to get our things filed until the governor's office could get a handle on all the legislation from all the different agencies. But we ultimately got everything filed that we wanted to, and we were successful in everything that we did file. The immunization registry, some of you may be aware that at one time it was only for childhood vaccines. It was limited to those under 22 years of age or younger. At one point, I think it was 2001 or 2003, we expanded that to adults. I take that back to 2007, I believe. We did expand it to adults, but there was an opt-out or opt-in reference in the law. And you had to do that to get it passed at the time. In other words, you could tell your doctor, I don't want to be in the registry, and they couldn't put you there. That becomes somewhat of a problem with electronic health records. They could seamlessly put this data in the registry. After several attempts, after several different legislative sessions, we actually got that passed. Now it's up to the doctor. You can still ask your doctor to take you out if you wanted to, but now it's up to the doctor whether or not they want to put adult immunization information in the registry. The second bill we did, some of you may be aware of the hair braiding issue. It was in the news. There was a lot of talk about overregulation in Arkansas by entities. It so happened it really wasn't a rule of regulation by you or the cosmetologist. It was actually a definition in the cosmetology law. It was a problem with hair braiding. Before we could get our bills filed, because we were sort of held up, Representative Ballinger took on that issue. And so it did pass. Hair braiders now have two options. One, they can do this without any regulation, or they can call themselves certified, and they can go through the process and get some training and become licensed hair braiders. The third thing had to do with really our fiscal issues. In 1999, the health department proposed that nursing home residents be vaccinated for yearly flu shots and pneumococcal. And also the health workers in the nursing home also be vaccinated. To get that passed, we had to agree to provide the vaccine. And so from 1999 until present, we actually provide the vaccine, we ship it to the nursing homes for their use. Since that time, most of these vaccines are now covered by insurance, and so we were able to get that changed. Now we're only going to provide the vaccine for those that are uninsured or underinsured in nursing homes. That's a potential savings of last year we spent $950,000 worth of vaccine.
But it's still required.
It's still required. Everyone will still have to get the shot, but for the most part, they'll be covered by insurance, Medicaid, Medicare. And for those that are covered, we will no longer have to provide that vaccine. The second vaccine bill that we got passed was really for vaccine reimbursement. 2 years ago, the legislature allowed us to start building third-party insurance because with the changes in the healthcare system with the Affordable Care Act, we were going to lose a lot of money on our Medicaid billing. We lost around $10 million a year. And so to make up for that, we were allowed to start building private insurance for the first time. We did build private insurance for flu shots, but this expanded it to all our other services. Unfortunately, and some of you may be aware, it's not that easy to get in the networks of all of these insurance companies. Some are very cooperative, some haven't been so cooperative. So we actually got a bill passed that says if we contact an insurance company and we can't come to terms within 90 days, then they still have to reimburse us for our vaccine and administration of vaccine. It wouldn't be for the other services that we provide, but we're really losing a lot of money on vaccines that we didn't lose in the past. So that was very important to get that, and we'll see how that plays out. The next one had to do with naloxone. Many of you are probably aware of that. It's an opiate antagonist, or it takes care of opiate overdoses. I thought Jim might be here. If somebody has an opiate overdose, they can actually inject this or spray it up into the nose, and they can immediately recover. So it's like a miracle drug if it's administered correctly. There was actually a sad case where a college student in Conway, going to UCA, was overdosing on an opiate. His friends knew he was in trouble. They put him on the couch and went to bed. They left some water for him in case he woke up. And sadly, they were within a block or two of the hospital, and that young man died. And so there were two bills that will hopefully help rectify that situation. One is that if you take someone to the hospital and they're overdosed, you'll have the grant of immunity. You cannot be prosecuted for anything that occurred. And the second thing is, with naloxone, family members, first responders, really anybody who really wants it can get the naloxone and they'd be able to administer it. Apparently, that young man who was in trouble had been smart enough to take him to the hospital, or if they had naloxone, it could save his life. So I think that's important. E-cigarettes on campus, on hospital campus, or on higher ed campuses. So there's already a provision in the law that you cannot smoke on higher ed campuses. That's been expanded to e-cigarettes now. We also had a couple of bills dealing with the prescription drug monitoring program. One will allow certain specially trained, certified law enforcement personnel to get access to the registry to do investigations. The other will allow physicians and other professionals to delegate the authority to access the registry. We understand that was a problem for some people because it actually required the professional, the doctor or the healthcare professional to access the registry. Now you can ask them in your office to delegate account. You can't get just anybody, but they can get a delegated account and nobody will do that for you. Those were the items that we wanted to get passed, and all were successful. As far as defensive actions, two of the biggest ones, the one had to do with fluoride. Obviously, fluoride is very passionate on both sides of that issue, so we all understand that. There were efforts to change the law, to take that the mandatory fluoridation out of the law, but that was unsuccessful. And the next one had to do actually with puppy mills. I thought I had a new low when I had to testify against heartbeat testing for newborns last time. This time I sent over to testify against puppies. So I think I hit a new low. But neither of those that we were really opposed to, it's just the manner in which it was going to happen. There was actually a bill that was filed, was amended to have puppy mills be regulated by the Board of Health. We didn't really think that was feasible the way it was written, the way it was, the amount of money that it would take to run that type of program. That's when it can interim studies, so it may likely come up. But I think everybody acknowledges there is a puppy mill problem, just on how to deal with that. The last thing, and I don't know if it was really something that we fought, we weren't successful at, was the massage therapy board. And I say that with respect to two gentlemen back here. The massage therapy board will be transferred to the Board of Health and to the department. They had some problems, mostly financial problems with the existing staff. They basically were insolvent. There were efforts to look at other places to put them, but ultimately it was decided that the Board of Health would be the best place for the massage therapy board. And so that will occur on October 1st, is the effective date. I actually told Senator Sample, who sponsored this bill, and Senator Bledsoe, who's on the Public Health Committee, that I guess we're going to have to start mistreating people because everybody wants to come to the board for the Department of Health. And that's really true in a way. The Cosmetology Board tried to, 4 years ago when we got them, 2 years later they tried to break away. Actually, Senator Sample actually was the sponsor of that bill. He tells me now that they're happy as they can be in the health department. Hearing interpreters, they were supposed to come to the health department as a temporary stopgap. Well, they're happy as they can do. They don't want to wait. So hopefully we can make the massage therapist feel as well. Or if you want to take another route, we can mistreat them and maybe we can I kind of touched a little bit on the nursing home vaccine and also the vaccine reimbursement. Many of you may have heard that the health department's budget was cut. You may have read the paper. I think in the paper may have mentioned $6.3, $6.4 million. Actually, if you take a look at just the core functions of the health department, we were cut around $1 million. We should be able to make up those cuts through the nursing home vaccine savings and also getting reimbursed for some of the vaccines we're not getting reimbursed now. The main cut, 4.9 million, that 6.3 was actually the community health centers. They had all the money cut. So we fared much better than that, I suppose. I'd be more than happy to take any questions that you might have.
Robert, on the puppy mill. What for a long time, our sanitarian inspected puppy mills and so on. Do they not do that anymore?
They don't. The actual, the initial legislation, actually, they wanted to put them under the, there were talks with the Department of Agriculture, and there were talks about putting them under the they're really, and the type of money that they were talking about that they could generate from fees, it really isn't feasible to do like a standalone project. Now, whether or not you can be folded into the sanitariums or you have existing staff out there.
We were doing it for years.
That would have to be looked at. But for now, I went into the study. It was actually a pretty contentious bill, I imagine. There were very passionate people on both sides of the argument, but it was obvious that it wasn't going to get out of it was in the House Ag Rep Committee. It was obviously not going to get out until the sponsorship board was put in study. I assume part of the interim study will involve issues with whether or not the health department's the proper agency to do that.
One of the things Greg desperately needs is an EMS medical director. And currently, we just approved the trauma budget, but out of the trauma budget, they funded an EMS medical directorship. So is there any hope? I mean, as I understand it, it's kind of like, well, we hope someday there will be some money so it won't come out of the trauma budget. And that's kind of where I'd like to see us go, get that money as separate and distinct funding for the Office of EMS and not take it off the back of the trauma system.
Well, unfortunately, and you're probably aware, the EMS program is not a money-making operation. With the way the fees are set up, I don't know how much money we actually have to help them with. But as far as I know, there aren't going to be any budget increases in the foreseeable future. If anything, I think we'd expect further budget cuts. That seems to be where people are going. And not to mention, it's necessary when you look at the budget and you look at all of the money in the Arkansas state budget. If you look at it, it all goes to higher ed, the prison system, and Medicaid. Those are the three monsters. And we're sort of next in line and way down the list. And so I felt we were fortunate to take this little cut as we did this year. Whether or not there'll be money available for that, I don't know. I can tell you that we're looking at how we're going to make that $1 million cut that we're going to have to make now. It's actually $1 million plus what we're going to lose on the cost of living increase, which is another $500,000. So there's not any extra money in the budget right now. Whether there will be in the future, if that's something we can look at, I think we all agree that EMS would benefit from having someone there. Whether or not it comes out of the trauma budget, the trauma budget was cut as well. So those trauma budget that was cut around 2%, I think. All of it, we were cut across the board. So everybody took a cut. And hopefully we can survive with the increased reimbursements. And hopefully we won't take much more cut. We can cut quite a bit if you look at our general revenue budget over the years. I think even before the cut, we were level with where we were in 2003. So I will tell you, we got the same general revenue that we got 12 years ago, and we're still trying to, and obviously cost of increase. So it's a tough thing right now, but obviously if we could do that, we would.
That was encouraging.
I'll tell you, the only thing that is encouraging about it is if we weren't getting reimbursed, we would be in big trouble from the private insurance companies. So it's going to be interesting how the healthcare, how that all works out as well.
So is the board taking a cut too?
You'll take a 2% cut now. Actually, your stipend was not cut. I made sure that didn't happen just because I think I'll get you all $75 that they're I looked out for you. You were retired.
I appreciate it. I do, Robert. You take care of it.
Thank you very much.
Amen.
Yes, sir.